I'm Stephen Carter. I am a UK and European patent attorney. Do a lot of work in the medtech space, so devices and digital health, as well as other areas. So I had the pleasure of writing all of the patent applications for the Speedo swimsuit that your Michael Phelps won all his gold medals in.
I did not know that.
I used to be known as the Speedo wearing patent attorney. It's an image I like to leave people with. But,
and that concludes our programming today.
So yeah, and I've
slide in your deck of you.
There is no slide in my deck. No. I mean, those swim trunks were so small and tight that they were very flattening. They were not very flattering.
10X events in San Diego. So I'm going to bring it back in. I'm still deciding between April and May of 2022. There'll probably be a pool at the facility. So just an idea.
There you go. The opportunity for everyone there. Gives me a while to work out for beforehand. Anyway, so I've been doing this for 26 years now. I've aged very well, obviously.
Obviously. Where are you working?
And spent most of that time in a couple of different London-based law firms. But just over 3 years ago, I guess I had some kind of midlife crisis. I don't really know, but lots of reasons behind it. But retired from that world and started my own IP consulting business. So still doing a bunch of regular patent attorney work, mainly European patent work for US-based businesses, but also the new side of the business is building up more of a kind of strategy practice, working with primarily UK-based startups and SMEs, helping them with IP strategy more generally, with still with a bit of a focus in the medtech space. But you know how it is with a new business, you end up with other people knocking on your door, and you don't often say no. So helping people who are making tree shelters and cashmere duvets and fire extinguishers as well, things like that. So anyway, keeps me busy, and actually loving it, and wish I'd gone alone earlier.
We met a couple times, of course, and you were even a 10X fast round guest, so I'm very familiar with your offering. I will say that today's topic is of particular interest to me because it's like playing cards. Do you show your hand, or do you keep it in, and what happens when you choose one or the other? So I think that this notion of when do I let anyone in on the secret is of acute interest to people with an invention. So please take it away.
Cool. So I will share my screen.
Yeah.
There we go. So yeah, that's me. We've done that. So I thought what I try and do, I've got a few slides to go through, and then hopefully plenty of time for discussion.
I'll interrupt as appropriate.
Yeah, that's what I'd expect.
Yeah.
And and I guess if you're kind, you might even give other people the opportunity to interrupt. But
that's my
which is fine. I'm happy with that. So I'm going to talk a bit about digital health and what I see as digital health, and the fact that it's an exploding area, both kind of in the commercial world and in the patent world.
You're saying digital health, will your lessons apply to non-digital?
They will, yeah. I mean, the lessons are fairly generally applicable. I mean, I picked digital health because it's, I guess, two reasons. One, it's kind of exciting, and it's the world that I'm working in a bit. Oops, Siri's trying to chip in and give me a football score or something. And two, it's one of the more challenging patent areas, because a lot of the digital health innovation is around algorithms, and we'll kind of look at that in a couple of slides' time. As to, there's still, I think, a general assumption out there that you can't patent algorithms or you can't patent software. There's a lot of people that still think that, and that's one of the barriers to businesses seeking the patent protection that actually they could have. So I'll have a look at some examples of what people are getting patents granted for, and then we'll have a bunch of time at the end to just talk about I guess kind of the balancing act of that, making that decision between do you patent or don't you. So in terms of, get these slides moving, here we go. Digital health. Right on a slide to wake people up. I know it's early in the morning over there. So I don't know if anyone else follows these CB Insights people, but they produce some pretty interesting data and statistics, including a quarterly report on the healthcare market. This is a report from, I think, published earlier this year, but looking back at 2020, and they published their Digital Health 150, which is basically the 150 startups and smaller companies that they think are kind of up and coming in the digital health space. But it gives a really good sense, I think, of the types of things that the types of innovation that is going on in the digital health space. So you've got everything from virtual care delivery down in the bottom right. So that's the kind of telehealth type providers, through screening and diagnostics, which is one of the areas I've been more involved in. So typically that's looking at clinical images and using AI or other technology to make deductions and diagnosis from those images. But then also things like, technology to improve the pharma supply chain, or technology so clinical intelligence and enablement. There's things like sort of clinical assistance systems, or the apps that you might, so Baby Scripts, for example, on there is an app for, I guess, tutoring or providing information to pregnant women in the early stages of pregnancy, kind of trying to answer those questions that they may want answered, like whether they can still exercise and what they should be eating or not eating, and how many bottles of wine are they still allowed to drink, which I think depends on which country you're in, doesn't it? I remember reading an article a year or two back, where the French market were in outcry because they just reduced the recommended limit for drinking wine when you were pregnant to 1 bottle a day. So
a bottle a day.
that was the outrage. They reduced it to that. So anyway, I move on swiftly. But anyway, I think it just gives this slide I think gives a good sense of how broad the area is. And I think as we'll come on to see, some of these things lend themselves to patent protection, some of them don't. But underpinning them is the fact that they're often driven by new algorithms. So that's kind of where the innovation lies. So this was just, I guess, probably everyone on this call knows this already, but just highlighting the fact that it's not just the startup and scale-up world that's excited about digital health. These great big digital giants are also getting in on the act through.
Data is the new oil, they say.
Exactly. So all of these big data-driven companies recognize the opportunities in digital health, starting their own digital health businesses, or acquiring businesses, or investing in businesses. So they're all pretty active as well. And then again, this is also from CB Insights, just a sense of the investment that's still being made, that we haven't really seen dip off through COVID times, and it's definitely on the increase again. It's interesting to note. One of the things that all of these graphs seem to show is that, and so I don't know whether you can easily read these, but the top left there is just looking at medical device startups, and then you've got telehealth startups in the top right, and then mental health startups in the bottom left, and healthcare AI startups in the right.
It's interesting to me that Q3 pandemic was a peak. Just that.
Peak. So it's interesting. Peak. The sort of the story that all these seem to tell is that although the funding, the funding is still going up, the deal flow, the deal volume has dropped in Q4 compared to Q3. Mm-hmm. So clearly there's more larger deals. Fewer deals, but the deals are larger. And that's only really kind of 1 quarter's statistics that are showing that. So maybe they'll pick up again. That might be cyclical. But anyway, there's still a lot of money going into the digital health and the medical device space. So patents for algorithms. So the next slide actually isn't specifically algorithms, but it's just it's the jurisdiction I know best, which is the European Patent Office. And actually, to anticipate a question, there might be nothing to do with digital health or algorithms, but to do with Europe and Brexit and what that means for patents in Europe. The great news for me, and also the great news for all the users of the system, is that the European patent system is and never has been anything to do with the European Union. So the European patent system carries on exactly as it was.
As independent countries.
Yeah. So it's countries beyond the European Union. So the European patent still gives protection in the UK, and good for me, someone based in the UK can still file European patent applications for people anywhere in the world. And I guess I included these to show that medical technology, which this is not pharma and it's not biotech. This is kind of tech in the medical field, has been the leading patent field at the European Patent Office for the last 10 years. Well, so there was 1 year where digital communication actually overtook medical technology, but for all of the other 9 out of the last 10 years, medical technology has been the biggest field for patent filings.
Maybe that's why you and Andrea are so busy.
Yeah, exactly. Yeah, and I mean, and digital communication is clearly there's an overlap between medical technology and digital communication when you're looking at digital health, and digital communication has grown massively since 2018 in terms of the number of filings.
I'm curious. I know it varies greatly, but when someone hires you and you take a role, how many hours do you need for a typical patent or typical engagement?
I mean, you're right. It does vary considerably, but sort of probably 20 or 30 hours to write on average to write a patent application. And yeah, first filing, which typically for my clients, I'd be filing in the UK and then looking to expand geographically down the line.
Once you've done the UK one and you want to do France, Italy, Greece, are they like copy paste and make a little change, or is it a big deal?
No, generally they're copy paste. I mean, if you hire a good patent attorney, kind of irrespective of where they are in the world to start out, they'll write a patent application that's like designed to be used everywhere. So there are differences in terms of what different patent offices will expect in terms of the the level of description you include, or how many drawings, or some of the phraseology used that's come out of the case law in the different countries that might, if you don't know about it, you might inadvertently limit the scope of your claims. But if you use a good patent attorney, they'll have a broad understanding of the important points in the main jurisdictions. And you're right, you can write a geographic agnostic patent application. So one that will work in Europe and the US. Sorry, I missed that.
If my device is patented in the UK and violated in Germany, is the German company, should you pursue a case needing to follow UK law, or, well, we're in Germany, we don't need to, how does that work? Because I'm thinking, great, I have an American patent, but the other 198 countries can violate it, and then what?
I guess the bottom line is you're screwed if you don't have patent protection in the country where the infringing activity is going on. So patents they're basically a negative right. So they're not
scary.
Yeah,
all it do is like have the guy infringe it in Canada. Like I have a guy in Canada, he's the infringer, not me, right? I mean, that seems like a pretty obvious loophole.
Yeah, well, it's kind of so the infringement, the jurisdiction of the infringement is where the infringing activity takes place. So if you had a Canadian company, but they were selling product into the US, then they're going to infringe a US patent.
I see.
So part of the strategy. Yeah, so part of the strategy decision when you decide it, because you can't file patents everywhere in the world. It would just be, I mean, even the big pharma, they file in a load of countries, like 20 or 30 countries in some cases, which is a massive expenditure for them. But for most of the medical device world, you're filing in 3, 4, 5 countries maybe, but you just pick off the big markets, because the reality is if you've got protection in Europe and you've got protection in the US and you've got protection in maybe Japan and Korea and Australia, you've all of a sudden made it fairly uneconomical for someone to set up in competition and sell their device.
You're saying that you're
only outside of those territories. So.
Your Sudanese equivalent is not as busy as you.
Exactly. And and the reality is you don't care, or commercially it does you very little harm if someone sets up and
you're distracted you enough.
No, that's fine. Distractions are fine. So over the years, I've heard this a lot of times. I wrote an article recently, actually, where I think I started off, actually, no, may not, probably a post where I started off and saying if I had a penny for every time someone had told me you can't patent software, then I could have retired years ago. But so there is this misconception, and I guess it's not surprising, because particularly if you look at the patent law in Europe, the patent law says in black and white on the paper, you can't get patents for computer programs, and you can't get patents for mathematical methods, and you can't get patents for business methods. So it's written there in the law. So people assume, those with kind of little knowledge,
they mean it. That they mean it.
That they mean it, yeah. And what they don't, I mean, and it's typical law. You look at statutes, and there's a couple of little words at the end of those provisions in European patent law that says you can't patent these things as such. And what that actually means is, well, you can patent software if it's the right sort of software.
You're saying the term "as such" is a catch-all that negates everything that went on the pages before.
not everything, but we'll kind of get to that. So then, but then people move on and they say, well, okay, I understand how you can patent software that controls a manufacturing machine, or because that's still a machine, isn't it? But they say, but surely you can't patent an algorithm, and the kind of answer to that, well, that's still wrong-ish. It's not entirely wrong, because the reality is that you can patent software and you can patent algorithms, but so long as what you're claiming as your invention is the practical, and in most jurisdictions, the kind of technical application of that algorithm. So if you try and patent the algorithm totally out of context, so it's just a mathematical method that you might implement in software, then you're not going to get a patent granted for it. But if what you've got is a kind of real world practical application for that algorithm, then so long as that practical application is something that falls within the realms of patentability, so basically it's something technical and it's not something in the arts world or in the kind of pure business method world, then you've got a good chance of getting a patent for the algorithm, so long as the algorithm meets the other requirements of patentability, which is it new and is it non-obvious, so something more than just the next obvious step forward from what's out there already.
So if Pythagoras showed up in your office, you'd be like, I can't help you.
Yeah, unless he says, yeah, but you can use my theorem for
this
this practical thing.
Got it.
Like measuring the height of a tree or whatever it may be. Yeah. And then just to give some examples, so I guess the point of the first two on there is that patents being granted in Europe and elsewhere for basically what amount to algorithms or software innovation is nothing new. So there were a couple of kind of fundamental appeal board cases back in towards the end of the 80s at the European Patent Office that were around this point. So these two are actually out of order. So the image processing algorithm case came first, and that actually was nothing to do with the medical world, but you can imagine, given that so much of medical diagnosis now is around imaging and the processing of those images, it's a very relevant case in this field. But yeah, IBM were granted a patent for image processing, so an algorithm that cleaned up images basically. And the case at the top there was case that's has been referred to a lot over the years, but it's Koch and Sturzel, who German X-ray machine manufacturer back in the day, and still possibly. They developed a new X-ray machine, but in fact the only difference between the previous device that was out there in the public domain and the new device that they were going to launch was the software code that drove it, and it kind of better controlled the balance between controlling the exposure of the patient to X-rays while maximising the contrast in the image. And so yeah, they come up with an algorithm that did that basically, and they got granted a patent for that. And then there's more recent examples that you can see on the thing there. So the ones towards the end are more relevant in this field, but algorithms that are used to determine energy expenditure using data from physiological sensors. So in the protection you're getting from the patent is effectively for a system using that algorithm, but it could be a computer system. It doesn't have to include the physiological sensors themselves. So it could be the app on your phone that's connecting to the it's using the camera to look at blood flow or whatever it may be, and deriving body temperature from an ear temperature detector, providing medical diagnosis. So these are all examples of things, and these are actually cited in the examiner guidelines in Europe now.
Andrea on, because as I look at this list, I'm wondering between you, and if your answers differ, what's the most effective way to detect if someone is violating your patent? I mean, how do you keep eyes on the world?
Well, there are two ways. You can get a snapshot in time by doing a freedom to operate or an infringement search, which is something that I do all the time. And basically, I try to look at the claims of all the patents out there and try to figure out, if your product would be infringing. Now, the reverse, if you're trying to figure out if somebody else is infringing on yours, I mean, you have to first find out, get a tip or find a product that seems to be infringing.
They're not filing anything.
I'm sorry?
The infringer is likely not filing anything because they want to stay under the radar.
Yeah, I mean, the way it's not patent against patent, right? It's really product against patent. So if you have a product or you have an activity, that's what you have to compare with exactly the claims of your patent, and word for word figure out whether it is infringing on your patent or not. That's the only way really to determine. If you want to see who else is getting patents and what you're getting, you know, that's when you do the patent search. That's when you can monitor what other people are filing. So you do competitor monitoring and kind of keep an eye on what other players in the field are filing on, and see if they're around the same area that you have patents on. Then you can keep a closer eye on the product and activities.
That competitor monitoring type analysis that Andrea does is super useful for various reasons. I mean, one, it's important from a risk perspective. So you want to keep an eye and see if your competitors are filing patents that could be an obstacle to your commercialization of your product down the line. Because if you identify them early, there's potentially things you can do about that. And patent applications are published before they're granted, so before the patent is granted. So you basically get advance notice, and often it's a number of years before they're granted. It depends on what procedure is being followed at the patent offices, but you get advance notice that someone's filed a patent application that's covering this technology, and you can follow the progress of that application, and you can challenge the validity of that patent if it's important enough to do so.
Beforehand, can I think of it as the equivalent of having a Google search for the names of the competitors that are most likly and words around your product, and you get an alert? Or is it more sophisticated than that? I'm sure there's a system that's not Google for you, but is it basically that, a layman's ability to relate to it?
Yeah, they're paid databases, right, that gather this information and allow us to create, with Google, you basically do this word and the other word and third word, and patent specifications are very, very broad. The claims are very, very long. And so if you just have you get a lot of noise.
Mm-hmm.
So there's all kinds of proximity operators and truncation and so forth. But then also there's patent classification, which is very, very useful. So let's say you're interested in urology, whatever, there's a niche kind of a field, and if there's good patent classification, then you just say, give me anything that's being classified in there that's being published every month, and then you get a list of those patents, or competitor names, inventor names. Yeah, there's a few different approaches you can sort of aggregate and get a good list of newly published data that helps you monitor what the players are doing.
Thank you. Now, Stephen, I remember from our fast round, I learned that, you're the guy to go to when you need a European patent, not when you need a US patent. There's someone else for that. I'm wondering, Andrea, as you listen to his presentation, is there anything that he's talking about that you're thinking, yeah, it's the same over here, or it's not the same over here?
No, I think most of what Stephen is mentioning applies to the US as well. And like he said, I think patent attorneys need to kind of be aware of what the patent laws are in different big jurisdictions. Like, they're not going to maybe know a small country, but the main medical device markets, they're going to be aware of that. And then also, if you're thinking of going more international, a way to do that is to file for a world patent or a European patent, and really any good attorney is able to do that for you. So it's more of a strategy aspect that Stephen wants to get into, is to figure out for long-term purpose.
Oh, she's back. You froze there for a moment, but I'll put you back in the gallery. Thanks for chiming in.
Yeah, but and Andrew's right there. I think what we've seen over the last few years is actually, if anything, there's been a convergence between what you can patent in the US and what you can patent in Europe in particular. So the rules are slightly different, but the answer at the end of the day is often the same. So when you have an algorithm-based patent, the answer as to whether it's patentable in the US and whether it's patentable in Europe oftentimes are the same. You get the same answer.
These are just here. Are these indicative of something, or just?
So these are just. I mean, actually, this is an example of. So Andrea mentioned the classification, and you can see on the sort of top
Right.
right patent there says field of classification search, and so that was actually how I found these. So there's a fairly granular classification of patent subject matters that the patent offices themselves apply to the patent applications when you file them. And so I did a search to look at kind of the intersection between particular kind of computer algorithm type technologies and medical technologies. And these are just kind of 4 examples of recently granted patents in the US in this space. So, and they're fairly representative of the sorts of patents that are getting granted.
The bottom left says field of classification none. What does that mean?
Yeah, it means, Andrew might be able to answer this better than I can because I've not actually seen it before, but I assume it means they've not been able to classify it, or it's granted so quickly they haven't yet classified it. Because I think so a lot of these
They're the first to attempt to do anything regarding diagnosing gastric cancer, so there's no precedent. That's what it means.
No, it'll be class that they're not that specific, or even there'll be some classifications that are as specific as medical diagnosis. But yeah, I don't know, Andrea. I've not seen a patent that's not been classified, but
Yeah, I've never seen that before. This is highly, I've never seen that before. So
these are all fairly recently filed, recently granted patents. So I guess they've all gone. There's a procedure in the US called Track 1, which is basically you can pay the US Patent Office quite a large sum of money, and they'll bump your application to the top of the pile and they examine it very quickly.
Mm-hmm.
So whether I don't know. I mean, I would have thought they would still want to classify it. So I don't quite know what's happened there. But yeah, but these are representative of the sorts of cases, patents that are getting granted. So there's quite a lot of activity around stroke diagnosis, based on CT images in particular. This Georgetown University one I threw in because it's kind of, I guess, it's relevant method and system for contact tracing. So that's not so much kind of medical in the sense of it's not diagnosis, but clearly it's COVID driven and COVID related. Telemedicine is another big area for patent filings. Determining orthodontic treatment, so these kind of treatment planning software is another area where there's quite a lot of patent activity in my experience. So again, it's a lot of these, so the stroke diagnosis and the orthodontic treatment system, and also the system for diagnosing severity of gastric cancer, they're all basically image processing systems, and so there's a good long line of cases that support the patentability of that type of innovation, so long as what they're doing is unique and different from what went before. The next slide, one is a bit fuzzy. Apologies for that. There's a snip from a screenshot. But so this is claim 1 of that last patent that was on the list, the cancer diagnostic one. It's just to give a sense of the breadth of some of the claims that are getting granted, and the significance of the claim is that basically the words in the claim here, that they're the definition of the picket fence around your garden that no one else is allowed to step into. Mm-hmm. So if someone steps inside your picket fence, they infringe the patent. If they're outside the picket fence, then they don't. And so you can see, they've succeeded in getting quite a broad claim here. So it's just a diagnostic system for determining a severity of gastric cancer. They use a processor that's programmed, so it's just basically a computer. And they get some images. And I guess the innovation they will argue, or they will have argued, is it's in this using 2 wavelength bands for the image collection. So they get two images. They look at the difference between those 2 images, and they've done some modeling that they then compare this against. That they compare this kind of difference delta image against, to determine how severe the cancer is, and then they have an output that says what the severity is.
Okay.
And that's I just think it was quite a good example of this is the sort of claims that people are getting granted, which if you weren't in the know, you might assume if you came up with this is at the end of the day, this is basically an algorithm. Take 2 images, look at the difference between them, compare the result with a database of images you've already got, work out which one it's closest to, and on the basis of that, give a result. That's basically an algorithm.
What I've learned so far from your presentation is algorithms are patentable as they relate to a specific application. The title of your talk is "To Patent or Not to Patent," and here we are. So I guess I'll just stop talking, because I'm quite curious about when do you show your hand? And
Yeah.
is this the second and last part of your presentation, or is there a third part?
No, this is kind of the second and last. And actually, there's not. I'm going to talk a lot around this, but there's not. There's only like 3 more slides or something.
Right.
Because fundamentally, it's so. I guess the whole first bit of that was, I guess, to demonstrate that. And because I like talking about that kind of stuff, I suppose, but it was kind of to demonstrate that. So a lot of people start with the assumption that you can't patent algorithms, and therefore, if they're in that digital health space, then they just don't even consider the possibility of patents. So I guess that what we've just talked about was dispelling that myth, and then we get on to but understanding that you can patent doesn't necessarily mean that you should. It just means it's an option. So you have to decide: do I take up that option or not? And this applies to any.
I like that. I think that would be my takeaway from your talk. Just because you can doesn't mean you should. And now I'd like to hear when you should.
Yeah. So as in all of these things, it's a balance, and the kind of the right or wrong answer in any case will depend on a number of factors, but they boil down, I think, to sort of two fundamental balances. And the first one is cost versus benefit, kind of a classic balance, isn't it? That we have to. So patents do cost money, and they can, particularly if you want geographic coverage in, even if you're only going to go ahead in 3 or 4 countries, you're talking about not insignificant amounts of cash. So let's take your average kind of medtech patent that, say, you file either in the UK or the US in the first instance. You file, as Andrew referred to, you file a PCT, or an international patent application, which, so there is no such thing as a worldwide patent. Doesn't exist. I don't think it ever will exist. But there is this convenient system called the Patent Cooperation Treaty, where you can file a single application that effectively, basically, it buys you the opportunity to file patents in, and I lose track, but it's like 154 countries or something now that you basically buy an option over when you file one of these PCT applications. And what it primarily does is it buys you time. So you file your first application on day one, which might be, for US-based businesses, typically that'll be US patent. It might be US provisional patent application. For a UK-based business, it would typically be a UK patent, sometimes a European. They'll file first. Up to 12 months later, you can file your international PCT patent application, and it gets backdated to the date of your first filing. And then by filing that, you effectively buy yourself another 18 months. So 2.5 years from day one before you have to make final decisions about which countries you're going to pursue patent protection in. But so if you follow that route, and let's say you then go ahead in Europe, US, and 2 or 3 other jurisdictions, over a period of 3, 4, or 5 years, which is kind of about how long it takes to push patents through those various jurisdictions to get them granted, longer in some cases, you're going to be spending tens of thousands of dollars. So probably an average for a portfolio of 5 covering 5 countries, it's probably somewhere around the $40,000-$50,000 mark to get the grant. So I guess my only point there really is it's not inexpensive. And you have to consider, maybe we'll come to that in a minute, but there's ongoing costs for renewing your portfolio of patents. And of course, if you're innovating and you're continuing to innovate, then you'll have new innovations that you might want to protect as well. So, when medtech companies are looking to raise money, quite a significant proportion of what they raise, if they've elected to go down that we're going to patent route, will be for the patent portfolio costs.
I'd like to, as you conclude this section, I'm scanning the list of our guests today, and I'd like to invite Brent and Eddie and Kevin and Sanjeev to join us on the call, because they've all invented something, and I'll be curious to know how they went about their patent decision. So please continue, and we'll just be on alert. Oh, and Lee.
lots of people. Yeah, and I'd be super interested to hear what their experience has been as well.
Mhm.
So yeah, so you got cost on one side, and then you've got benefit on the other. And so what are the benefits? So there's I guess, the traditional role of a patent is to give you a big stick that you can hit the competitor with if they start treading on your toes. And that's still one of the reasons people get patents. Obviously, if you're going to start hitting them with a big stick, then that involves more expense, more cost. And one of the things we've seen more recently in the UK are actually some fairly cost-effective insurance policies that you can take out as a patent holding SME to insure yourself against the cost of enforcing your patent. Which they can be quite effective, because one of the
That's really interesting. Like a portfolio. So a company has thought up the concept of a portfolio management approach to patent protection, and that 2% will actually need that kind of protection, and everyone's paying a premium for it. That's smart.
Yeah, exactly. Yeah. And patent IP insurance has been around for years, but it's typically been, the premiums have typically been out of the reach of the smaller businesses. There's 2 or 3 providers in the UK now that will
Compete for the business.
compete for that small business, small company business.
Mhm.
So that's one benefit. But actually, for the smaller, for the startups and smaller companies, it's often not the main reason that they're filing, in my experience anyway, the main reason they're filing patents. It's that the fact the patent's got potential to be able to do that down the line, I guess, is underpins it all. But investability is probably one of the biggest reasons that smaller companies file patents. So there's still, again, in my experience, I'd be interested to hear what other people's experience has been with this, but a lot of investors still want you to have patent protection for your innovation. And sometimes, even when actually that's the wrong thing to do, because actually we can bring in the other balance that kind of feeds into all of this is the balance between disclosure over secrecy. So when you file a patent application, you necessarily publish a lot of detail about what you're doing and how you do it.
Exactly.
And it doesn't get published straight away, but it gets published before the patent's granted. And so in the normal course of events, it's published 18 months after the first application you file.
Mm-hmm.
Whereas for some innovation, secrecy can be a really powerful form of protection.
Mm-hmm.
And you see, I've seen this tension between investors saying, you've got a patent, you've got a patent, you've got a patent, even where there's probably question marks over whether you're actually going to get a patent granted for this software innovation.
Like, what a waste. We went and showed our hand and we didn't even get the protection, and we spent money.
Exactly. So there are quite a lot of cases, in my view, where secrecy is the better option. But you have to, and sometimes it'll be a combination of the two. So you sort of stop and ask yourself, well, what is it we're trying to achieve? Typically you're trying to stall the competition, stop them playing catch up so quickly, so you can get first mover advantage and your product gets out there and you make lots of money out of it before the competition catches up, and hopefully you carry on innovating and you stay one step ahead of them. Or and having a patent can help you stay 2 or 3 or 10 steps ahead of them, because you can beat them back with your stick. But also sometimes keeping what you're doing secret can also give you that benefit of getting 2 or 3 or 10 steps ahead of them, because if they just can't work out what the hell you're doing or how you're doing it, and what you're doing is actually really quite smart, then they just may be unable to catch up in a way that's as effective.
I wonder if your unscrupulous competitors would advise everyone to get a patent, because I don't imagine the Carter organization makes a lot of money for people who decide not to use your services, unless you bill them for an hour's worth of consultation and that's it. Would you say you've seen that where they're like, oh yeah, absolutely, and they don't really consider the secrecy part?
I think so. Probably yes is the honest answer. I mean, one of the reasons I guess I'm building my business, looking at it selfishly, just for a minute or two, one of the reasons I'm building my business the way I'm building it is actually,
you'll tell people that you don't need me.
Yeah, or I'll tell them that actually what you need is someone working for you on a part-time basis who's close to your business and can make the decision for you as to whether it should be secret or patent protected. and then let me tell your patent attorney firm that you're working with already whether they should patent it or not. And that's I think one of the issues is that a lot of, because when you engage a patent firm like the firms I've worked for, and you're very conscious that as soon as you pick up the phone to someone like me at one of those firms, the stopwatch starts and you're getting billed at $500, $600 an hour.
Mm-hmm.
You're reluctant to ask those questions, so
Mm-hmm.
you try and work out for yourself what you should be doing.
Right.
And then you go to the patent firm and you say, file me a patent application, and they go, well, yeah, that's what the client's told us to do, so we're going to do it.
Mm-hmm.
When actually it might not be the right thing to do. So yeah, and I think that's very broad brush, and there are some very good firms I know that would push back and go, why do you want a patent application? And there is, actually for some of the law firms, there's quite a lot of money to be made out of helping clients implement trade secret policies, and then trade secret enforcement actions can be super lucrative. So it's not, there's other ways of making money. But
I suspect you have more to share, but just my friends on mute, but just a show of hands, how many of you have filed a patent on the things you're working on? All four. Okay. No secrets here. So I'll unmute them in a bit. What's your next slide?
This is my last slide, but I'm just going to waffle on a bit more about the benefits and the balances.
Okay.
So where was I? So I guess coming to your point there about choosing to disclose. So you do choose to disclose when you file a patent application, but you don't necessarily have to disclose absolutely everything. So there might be aspects of your innovation that lend themselves to patent protection, and there might be other aspects that actually you can realistically keep secret. And that the secrecy question is something you have to consider quite carefully in the context of your business model and the regulatory environment you work in as well, because you'll find yourself in some cases you have to disclose certain amounts of information, because if you don't, either the regulator won't allow you to operate, or just the sort of condition, the expected norms in the marketplace means that you won't succeed because the particular marketplace doesn't like people who keep secrets. And then also often a lot of this innovation comes out of academia, and in academia there's the pressure to publish as well. So that's another tension you get when you're making these decisions, is you get pressure from academia to publish. You want to keep stuff secret, and then in those scenarios often the answer is to patent, because then you can patent, they can publish, you get the protection or some of the protection you want, they get to advance their academic career. And that works well. And then in terms of other,
I'm sorry, Elizabeth, that I missed you in my scan for raising your hand. Now, show of hands from you. Is your innovation patented? Yeah. Okay. Actually, you're all welcome to take off your mutes. And
I think it'd be interesting actually if we had more of a kind of mixed UK-US audience, because I think you'd see a lot of hands from US-based businesses. Probably 90% or more of US-based businesses would stick their hand up to say they patented, and the percentage of UK-based businesses would be lower. I know it's UK-based. I think there's always businesses UK-based.
I'll just read. Andrea writes, as a general rule, it's wise to get patent protection on something that can be reverse engineered.
Yeah, I'd agree with that. Yeah, because in effect, if you put something in the public domain and it can be reverse engineered, then it's no longer a secret. You can keep it as a secret. So patents are your only option at that point.
Any of you, you're welcome to go first and talk about your patent experience, or if you have a question for the doctor.
Well, Stephen, thank you for your talk. I appreciate it. In one of my current companies, we've spent the last 4 years in the patent process. We have 74 patents now. And you're right about the cost of it. We're well over $500,000 in the process. But when you start doing a business in med tech or medical devices, you better be planning for a liquidity event at some point. And that liquidity event is going to be either an acquisition by a major strategic, or it's going to be some sort of public offering. And it's been my experience, and we're in the process now of selling one of the companies, being acquired by a major strategic. One of the first things and most important things that they will get into is your IP. And it is unlikely having done this a few times, it's likely in my experience that they're going to take a serious look at you in medtech if you don't have serious protections of your IP. So I think that's what drives a lot of the US companies to doing what you're talking about. The second thing I would say is, it's unlike our technology portfolio, and unlike our, technologies that are quite revolutionary and unique, and I know Joe's quite familiar with them. Software patents, algorithms are much harder to protect, is my impression. It's hard to engineer around technology. It's much easier to engineer around a software-based IP, especially if it's going to be something like an algorithm. You don't have to make a lot of changes in it to be unique from what's been patented. So what's your thoughts on that? I mean, how much protection do you really get from the patent? I guess is the question I'm asking when it's talking about a software or an algorithm.
It's a good question, and I think you're right so you're definitely right in the sense that if you have a kind of fairly narrow algorithm focused claim, then it doesn't take too long for a competitor to design around it, come up with a slightly different algorithm. But I guess it's the same. In some way, it's the same with device patents or other kind of physical technology patents. Is that you can write them in a way that makes them very specific to your device and make it easy to design around. So with the algorithm or software-based patents, I guess the skill is still to try and draft them in a way that captures the underlying, the sort of concept that underlies the innovation you come up with. And sometimes that's possible and sometimes it's not, because sometimes the underlying concept is something that's just too obvious or actually exists out there in other forms anyway. But in the same way you would with a device patent, you try and stretch the scope of the claim beyond the specific implementation as far as you sensibly can. And I guess the other issue, which I think maybe we're touching on there, is the detectability of infringement. So if someone's selling a device, then you can, one way or another, you can acquire one of those devices and you can take it to your lab and you can rip it apart and work out whether it infringes your patent. If someone's delivering a service like a telehealth service, where they're running their software on their own servers, it's much more difficult to actually understand what they're doing. And you have to make, it's a bit like, I guess, process. This issue's existed with process patents for years, so manufacturing processes and the like. But if the process is being operated behind closed factory doors, then you can struggle to identify whether someone is actually infringing. But you have to make deductions based on the output. So if they're delivering very similar end results, you might deduce that they're using an approach that is the same or very similar to yours. And a court, it's only courts in the UK, if the output is similar enough, then you might have enough there to force disclosure of the process that's being undertaken. So then you can make that determination of whether there's an infringement or not. But it's not. You're right. It's not straightforward, and that's one of the other things that factors in, which is because of those difficulties. One in getting broad protection in the first place, and two in the enforceability or the detectability of infringement. It pushes that balance towards the secrecy side of the balance rather than the patent side of the balance, if you can realistically keep those algorithms secret. And I was having exactly this discussion with a client earlier this week, end of last week, I think it was. Where again, they were getting sort of pressure to file patent applications, and we were putting together a case to say why it was actually better to keep these algorithms secret. So. Oh, you're on mute, Jay.
I am. Thank you for that. Someone else's experience, Elizabeth?
Thank you, and I apologize for coming in so late. I look forward to listening to the recorded first part of your talk. So one of my business mentors in the medical device space said to me 12 years ago, she said, patents are really probably not that important for her line of work, and it has to do with skincare products and mouthwash and all. She said the secrets are more important than the patent. That was in her line of work. In my line of work, I have known and have followed the rule that it sounds like you're advocating is the secret part, as long as you can. However, I have filed utility patent and multiple design patents, because what we are creating is a very simple tagging process, actually. And what we're doing, the design patent is probably going to be a lot more valuable than the utility patent will ever be. And so we were successful in obtaining some design patents, and that was through our patent counsel. But just this week, I spoke with someone in the UK about doing some human factor studies for me. We talked about the patent process and and he's actually in Sweden, but the company's a UK company. They do work in Texas. And so I met him this week. And he said, in Europe, it's very different. This is all about the trade secret. So when our product is introduced to the marketplace, it'll be the design work that's going to be the most valuable to us.
Stephen, your thoughts?
Yeah, and it makes sense. Obviously, it depends on the nature of the product. I mean, designs. So in Europe, we refer to them as registered designs, so design patents in the US, but they're basically a form of registered protection that protects the appearance of something. So its shape, it can be pattern and ornament in some cases, but in this kind of field, it tends to be the shape of it. And you can't, so with a design patent, with a registered design, you can't monopolize the one shape that will perform the function you want to perform, but it's pretty rare that there's ever one shape. And it is all about, a lot of this is about slowing down the competition as much as you can.
Correct.
You want to stop them ripping you off by simply imitating you. You want them to have to go through the pain and the cost of developing their own product, even if ultimately they're going to launch a product in a few years' time that performs the same or very similar function and will compete with yours. If you can put some obstacles in the way that make that process more costly and more time consuming, then it gives you that head start. And actually, one of the things we haven't, unsurprisingly, haven't touched on, because this was talk about patents, is trademark protection as well. And when I'm talking to clients, we look at, I encourage them to look at sort of IP holistically, and particularly when you're bringing product to market, it's about when you're developing a product, you can often identify, and this is the way I tend to work with clients. Let's look at what are the IP assets that underpin the value in that product. And yes, there'll be the kind of technical innovation. Oftentimes there'll be the design innovation. But there'll also be might be some database rights that fit into the mold. There might be, and there's likely to be, if you're going to market, there's going to be a brand. And so you've got this kind of collection of IP assets that underpin the value in the thing you're taking to the market, and then you can have a corresponding mosaic of IP protection that puts as many obstacles in the way of the competition as you can.
We have trademarked. We actually have trademarked. We probably have 12 different trademarks right now, and design marks, so character marks, and that's what we have developed with the concept of this very simple future product to go out on the market. That actually has worldwide application. And it's literally taking, I'm trying to compete with Scotch tape, with tape, something so simple, so simple. And it's the design work and the trademarks that are probably much more valuable than the utility patent. Miraculously, we actually did obtain a utility patent after 3.5 years of going back and forth with the patent examiner.
I brought Rick on because he is a designer. He had a comment, but is what Elizabeth's saying resonating with you, Rick?
Yeah, it is. There's always that push me, pull you, trying to figure out how long to keep something a secret. And I sort of had a question. I wondered has anybody ever approached you with the specific request of, I don't want you to write a patent, but I want to keep this secret, but I would like to show somebody who might want to invest that I've had a very credible patent search done and that my product is unique, but I want to maintain the secrecy until we have money to go forward.
Stephen, before you answer, I want to read something that Lee wrote. He said, I find the process of writing and creating the patent documents is a very useful management tool. It causes management to really understand the details. To have an idea is great. To get it on paper is greater. To get it reviewed and challenged by patent agents and legal counsel gets you really refined. So he's suggesting, in essence, okay, just like a mock, I don't want you to actually do it, but do I have something here? I think is what you're saying, Rick.
Yeah, except explicitly, I don't want to get a patent. But when I have an investor come, I want to be able to tell them, listen,
That
we're
you've done
keeping
the
it
work.
secret, but
Right.
we've done the work and it is unique.
Right.
Anyone ever asked?
So I guess, no, I mean, the answer is, I've not had someone come to me with that specific question. I've had plenty of people come to me that want a patent search conducted before filing a patent application to determine how unique their product is, to then assist in that decision as to whether they want to go ahead or not. And so actually Andrew's just commented as well, but
Right.
and yeah, the other
Wanna read
scenario,
that
you
out?
get a lot of cases where people want a patent search done that they can share with investors to show that they're not going to be infringing anyone else's patent. So it's kind of a freedom to operate exercise.
So I kind of want to just comment and kind of piggyback off of Rick, because it kind of was along with, comment I was going to make anyway. And that is that push pull, or I would say it's almost like a chicken and egg type problem. You know, you want to keep things secret, but, you know, investors want to know that you've got protection. And then all of that is kind of wrapped around also the timing question. You know, when, if you do want to do a patent, you know, the best path is to hold off as long as possible, so you then have as long a period of protection at the back end, and then because you still have to work through however long your regulatory pathway is. So you wind up, you know, you have to get the patent protection to make the investors happy, but then, you know, by the time you get a product to market, you've already burned off 7 or 8 years of what would have been valuable protection time. And that kind of costs the investors, but, you know, that's what they want up front usually.
Yeah, and it's a juggling act in that, because, you know, there's various tensions pulling in different directions. So yeah, clearly, like, so the most obvious one is that also in Europe, we have to have the patent application filed before there's any public disclosure of the invention. Obviously in the US, you have the grace period, which if you only focus on the US, you might make use of. So that's one of the tensions, is that, yeah, if you're going to go down the patent route, that decision has to be made before you publish any sort of detailed information about what it is you're doing. Then, you know, like we identified earlier, and you just said there, you've got the tension of investors wanting you to file patent applications early, because they kind of want that right tied up, that exclusivity tied up, against wanting to file later. One, because you know, you let your budget stretch further, but also, as you say, there's that kind of back end benefit of the later you file, the longer into the future your patent protection goes, because you get 20 years from filing. Yeah. And I guess the, you know, other factors that you throw into the mix there are, well, what's the longevity of this device or this algorithm or whatever it may be? What's it going to be? So, you know, sometimes in the digital health space, things are moving very quickly, and innovations are happening quickly, and actually, you know, you never anticipate using the full 20-year life cycle of the patent.
Well, I'm coming at it from the materials and chemistry side, where you know, we're trying to evergreen whatever we can. And I was actually having the discussion with our patent attorney yesterday. You know, that we were actually having that exact discussion. At what point do we maybe need to file in other jurisdictions, and how do we find other ways to apply our technology where we can maybe stack on the patents? Yeah.
There's a whole
That would be an entire presentation right there.
Yeah.
Yeah, no, you're right. And I guess the other tension that comes into play sometimes is the competitive tension, because if you're in a competitive field where there's concerns that, you know, you've got development teams in competing companies all working in the same direction, then, you know, the patent system is a first to file system. So what you don't want is your competitor to file a patent for the thing that you're working on as your next big product. So that pushes you towards filing early again.
Yeah.
Well, just briefly, we've been through a lot of this very, very recently. So our device here, we've got a patent on this that was filed initially in the UK in 2018. So we extended to a PCT, and literally just last month we had to decide what countries to go forward in. And you know, right now we're going through fundraising. So we chose a limited number of countries for this, because we've also just filed a brand new patent on the way the delivery mechanism locks into the device, with the theory that, you know, as that one marshals through the process, once we're in the market and we're generating revenue, we could choose a larger number of countries to pursue the other part, but because the two are integrally linked, it should extend the life.
Yeah, no, you're right, and that's the kind of smart strategy that you can deploy. I mean, just sort of related to that, I guess, when you're making these decisions about which countries to go for, there's various factors you take into account. People typically say go for the big markets or go for where your competitors have a manufacturing base. But I think another smart way of doing it, particularly for a smaller company where the likely exit will be an acquisition by one of the players in the market, is you can look at what their geographic strategy is, and within the budget available, mirror that. Because then that automatically makes you
one cautionary thing for my US based friends: when you look at Europe and you do this whole EU patent approach, be very careful. One of my previous companies, I inherited an IP portfolio of a company that, when it filed its patents, it must have been incredibly cash rich. I was getting patent renewal notices for translation into Serbian to maintain it that was completely useless. And it was amazing to me how frivolous this company was in terms of where it chose. But again, the main point for folks in the US is when you go across Europe, you do have to pick each country. And in every country, there are slightly different rules about what you need to do. And some of them insist that you have to translations every time you have rules. And it can be quite costly across the whole 28 countries or whatever it is.
Thanks, Eddie. Sanjeev, as we wrap, tell us about your experience. You're not on mute, it seems, but I can't hear you.
How about now?
Yes, thank you.
Okay. My microphone was on mute itself.
Okay.
So what we had done was we filed provisional patents initially because that's how we could get the investors. So the way we went about doing it was we licensed certain technology patents which were already issued. That way we were able to get investors to come in. Once we got that and we told them what our strategy was, we would develop an instrument, etc. And then we filed provisional patents and we got a year essentially and to be able to file the actual patents. And we went about doing that. And then we had to pick countries when we did the PCT filings. And we were looking for low cost products. That's what we were designing. So the markets for us were very big in China and India. So we decided to file in those countries. And the process was pretty tedious and expensive, but we had to do that. What I've always wondered is why there isn't, it's like drugs. When you go from one country to another, you still take the same drug. Doesn't matter whether, and it may not be FDA approved. It may be approved in one country, but not in another country. And if it didn't kill you there, why can't you take it in another place? The same thing with patents. Why can't they be applied across the world and you just pay a license fee rather than have to go back and refile and all of that, right?
Yeah, it's a good question, and it's one that people were debating when I joined the profession 26, 27 years ago, and they're still debating them now. And the reason they don't fundamentally boils down to politics rather than practicalities, because countries don't want to give up their own ability to decide whether they're going to grant a monopoly in their country or not. And you get into arguments over the standard of examination. Just so there is more. We're moving slowly in that direction. So there is more sharing of work product between the bigger patent offices. So the European Patent Office and the US Patent Office and the UK Patent Office and the Japanese and other sort of large patent offices in the bigger countries. They share a lot of work product. So they're trying to shortcut or benefit one another in terms of examination of the patents. So they've been kind of more thorough in granting the same patents and not granting the others. I mean, they still all make their own independent decisions, but the sharing of that work product. And there are mechanisms for accelerating the processing of patent applications in other countries once you have a patent allowed in one one jurisdiction. So there's they call it the patent prosecution highway. So if I get a patent allowed in the UK quickly for one of my clients, I can use that allowance in the UK to not to get a patent allowed in the US and Europe and Japan, but I can use it to skip the queue to accelerate the examination. So they are, there's slowly there's movement in that direction, but there won't be any such thing as a worldwide patent in my lifetime, and I doubt in my kids' lifetime either. Which is a shame for business. It makes perfect logical sense, I guess, in a lot of cases.
Yeah, technology is technology, and if someone else hasn't filed it, why not give the patent to the person worldwide or the company so they can use it throughout?
I guess there's arguments against as well, in the sense that the starting point for a lot of the patent systems is that monopolies are bad things. So giving someone a monopoly over a particular device or a particular drug is actually inherently bad, and the justification for it is that by allowing people to get a monopoly, you're encouraging them to innovate, and you're encouraging them to make the investment in that innovation that they need. And you could argue, I suppose, that if for every innovation that was patent worthy you gave them a worldwide monopoly, then maybe that's not saying more than they deserve, but more than they need in order to encourage them to make the investment in the innovation. So you're kind of giving people a monopoly when you don't need to get that economic incentive to innovate.
Thank you. So
Indeed.
I'm going to invite you to follow up with Stephen on MDG Premium. As you can see, this is one of our longer presentations. There's a lot of interest in what you have to say. In fact, there are still 2 more questions here. I'll tell you what they are, and you can decide how quickly you are able to answer. Jan asks, why are companies hesitant to patent unique packaging? And Eddie asks, what's your view on filing patents in China? So speed round.
First one, don't know. You'd have to ask the people that are innovating the packaging. It would seem.
I will offer, just as Jan often finds people not thinking about hiring a packaging engineer, that regrettably packaging is an afterthought for most people and they don't even think of it. Just a quick anecdote. I used to work for Kraft General Foods, which owned the Jakob Suchard, which is the confectioner that makes Altoids. And they were the first ones to distribute candy in a metal tin. And had they patented that concept, all the metal tins that followed would not have been able to enter that way. I'm given to understand. So there you go.
Well, see, and Andrea comments quite correctly that the packaging IP space is very crowded and old. So I've worked on cardboard carton patents in my early days. And actually one of my claims to fame, I don't know if you have them in the US or not.
Speedos, right? Speedos.
Well, the Speedos as well, yeah. But I was going to talk about milk cartons, plastic milk cartons. They have the tear off seal underneath the cap.
Yeah.
And they used to have a kind of a tiny little
circle
protruding braid that you could grab off, and it would often rip off. And then the innovation was they had a semicircular flap that you could then, so it gave you more to grab hold of. And I wrote the patent for the semicircular flap. That was one of my other claims to fame. So
fair enough.
Anyway, and filing in China.
Yeah.
So I think it's the patent kind of IP environment in China has improved a lot over the last few years. I've never litigated or been involved in the Chinese litigation, but you certainly see stories of Western companies successfully enforcing their patents in China. So I think it is worthwhile now. It's one of the less expensive countries. It's still not cheap. It's one of the less expensive countries. So it's maybe not in the sort of premiership division in terms of countries that you might choose to file in, but it's probably in that kind of second tier of countries.
Fair enough. A lot of interest. Appreciate it. And we'll have this on our archive. Next week, I'm excited about, we have David Alpert, the founder of AliveCore, as our guest. So that should be a really interesting session. Stephen, we should do this more often as a function of how not busy you are. You want to just hang?
I've enjoyed it.
Or something.
We should do more. I should attend more, definitely.
That'd be nice. Ladies and gentlemen,
Oh.
Stephen Carter. Thank you, Stephen. Did you have a closing thought?
It wasn't a very good one. It was going to be that these are at 4 p.m. on a Friday afternoon, which is when I'm normally thinking about my first gin and tonic. But...
All right. Well, then I'll conclude with dun 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 dun. Stephen Carter. Thanks, everybody.
Okay.
See you next week. Bye.